DPT, or dipropyltryptamine, is a psychedelic with an intensity similar to DMT. Far less is known about the drug, even though it was studied in therapy settings and has existed for decades. As always, there will be more information and links to references on thedrugclassroom.com, which you can find using the link below. The positive effects include closed and open eye visuals, auditory hallucinations, time distortion, meaningful experiences, music enhancement, euphoria, relaxation, and stimulation. Among the potential negative effects are paranoia, temporary psychosis, anxiety, nausea, dizziness, increased heart rate, and tremor. The effects vary by the dose. At lower doses in the light range, the primary effect is that of an altered psychological state with relatively minor visual distortions. Some of the potential effects at this dose are greater memory recall and greater emotional fluctuation. It's common for there to be a sort of internal self-exploration, and there's usually an absence of severely altered thinking. Slightly higher doses in the low common range are reported to be lightly to moderately visual with some psychological changes. There's usually an increase in the negative effects, such as sweating, perceived tachycardia, and nausea. It might be difficult to move around. It's comparable in intensity to DMT and 5-MeO-DMT when you use a dose capable of causing a strong psychedelic effect or a breakthrough. The emotional effects are more variable than with DMT, and on average, it's considered a stranger, more confusing, and less pleasant experience. However, the effects span the full range, from amazing and wonderful to depressing and terrifying. A lot of people report it to be psychologically difficult, at least during parts of an experience at full doses. DPT's perceived physical effects are usually stronger than with DMT. Users sometimes report sweating, tremor, nausea and vomiting, and the sensation of a very fast or strong heartbeat. Feelings of being pushed against or pushed down may be present. A strong vibrating feeling, which is sometimes uncomfortable, is commonly, though not always, reported. This combination of effects makes the drug feel harsher on the body than DMT. Usually, the more all-encompassing experiences occur with eyes closed, though this matters less with sufficiently high doses. With eyes open, there are often complex visual distortions and even freestanding hallucinations. It can be very disorienting. Feelings of being spun around, unable to move, and of moving at a high speed have been reported. A common occurrence with higher doses are strong hallucinatory effects that effectively or completely separate you from reality for periods of time. During those periods, some users report seeing earlier memories, feeling as though they're dead, feeling like they're flying through space, or encountering entities, sometimes of a spiritual nature. A remarkably wide range of hallucinations can occur. All of these effects are highly variable between individual uses. What's less variable is the core point of DPT being intense and all-encompassing when enough is used. I've seen many reports claiming it feels darker or less natural than DMT, but there's certainly a fair number of highly euphoric or bliss experiences. It's less recreational than other psychedelics. At the same time, there are reports where the effects are very visual but lack any psychological distress or negative physical effects. In these cases, it's even occasionally described as a preferred psychedelic. Some tests have been done to see if it could be used in therapeutic settings. It was primarily examined in cancer patients and alcohol addicts. Some trials were positive, but there was never enough research to make any conclusions. In one of the cancer-related trials, the mean dose was around 100 milligrams intramuscular. Significantly distressing experiences did not appear common in this group, and the outcomes were suggestive of lower depression and anxiety. Perhaps this is an instance of set and setting being of supreme importance. It should be noted that effects with oral administration are even more temperamental than with other routes. Some people get effects with higher doses, while others cannot get it to work even with a couple hundred milligrams. Taking it with MAOIs may change the efficacy, though a larger amount is still taken than with other routes. The duration is usually extended as the dose increases, so I'm including the duration for common amounts. Orally, it lasts for 2 to 4 hours and works in 20 to 60 minutes. Intranasally, it lasts 3 to 4 hours and works in 5 to 15 minutes. When inhaled, it lasts 30 to 60 minutes and works in under 2 minutes. And when taken intramuscularly, it lasts 3 to 4 hours and works in 2 to 10 minutes. DPT is a synthetic tryptamine that's structurally similar to DMT. It differs from DMT in that two propyl groups have replaced DMT's methyl groups. Between its effects and some studies in animals and cloned human receptors, we have some understanding of its pharmacology. The drug appears to work as a 5-HT1A partial agonist and as a 5-HT2A agonist. Other serotonin receptors and non-serotonin receptors could potentially be involved. DPT is usually taken via inhalation, intranasal, or intramuscular. The dosing is complicated due to the significant variation between users. It's not impossible for a low common dose to yield significant activity. You should always start with a light dose before attempting larger amounts. A light oral dose is 50 to 125 milligrams, a common dose is 125 to 250 milligrams, and a strong dose is over 250 milligrams. A light intranasal dose is 5 to 20 milligrams, a common dose is 25 to 100 milligrams, and a strong dose is over 100 milligrams. A light inhalation dose is 10 to 20 milligrams, a common dose is 20 to 50 milligrams, and a strong dose is 50 to 100 milligrams. And a light intramuscular dose is 10 to 20 milligrams, a common dose is 20 to 60 milligrams, and a strong dose is 60 to 100 milligrams. DPT appears to have been synthesized in the 1950s. A report in 1954 showed it was active in dogs, and hallucinogenic activity in humans was confirmed in the 1960s. A few studies for therapeutic purposes occurred in the 1960s and 1970s, a number of which involved Stan Grof. It was found to potentially have efficacy in addiction. The research in cancer patients was tentatively encouraging and was covered in a 60 Minutes episode during the 1970s. DPT is frequently mentioned in connection with the Temple of the True Inner Light, a group that has used the drug for spiritual purposes since the 1980s. They reportedly inhaled the drug or take it orally. Use outside of that group is poorly documented, but it probably was used elsewhere to a limited degree prior to the 2000s. DPT was being sent to labs in the US with a greater frequency around 2005, according to the DEA. Research in the 2000s confirmed some of its activity at serotonin receptors. As of 2016, the drug is still unscheduled in many areas and is available from some research chemical vendors. It remains a less popular psychedelic. The drug is unscheduled in the United States, though it is controlled in Florida and Maine. It's scheduled in Belgium, Latvia, Greece, Japan, Sweden, and the UK. There's little information to go on when determining its safety, but every indication is that a common dose in healthy people should not be physically dangerous. In some respects, it appears to cause more physical effects, like sweating, tremor, and tachycardia, than DMT, but there's a lack of fatalities. One alleged death was reported in Minnesota in 2015. A teenager purchased DPT online, and he was found suffering from seizures after taking an unknown amount. I was unable to find any confirmation that DPT was to blame. The greatest concerns are with the psychological effects. It seems possible that temporary, if not extended, periods of psychosis could be triggered. Anxiety and paranoia are even more common. So, it shouldn't be combined with existing psychiatric problems. If you have any questions, feel free to leave them in the comment section. In order for the Drug Classroom to provide more education, support is necessary, and the best way to support is through Patreon at patreon.com/thedrugclassroom. You can also contribute through PayPal or Bitcoin. You can reach me on Twitter at Seth A. Fitzgerald and via email at seth@thedrugclassroom.com. More information and links to references can be found on the TDC website using the link below.